March is Kidney Health Month. Do you know how to keep your kidney healthy? Welcome to AAMG YouTube channel. My name is Esther, your host. We are very fortunate today invited our AAMG internal medicine physician, Dr. Wei Rao. She will help us learn about some common kidney diseases and how we can prevent them. Welcome, Dr. Rao. Could you introduce yourself to our viewers?
My name is Wei Rao. I'm an internal medicine doctor. I basically serve as primary care in the community. So it's my pleasure to share some information with you regarding how are we going to care for our kidneys. They're precious. We only have 2 kidneys. And so I wanted to share some basic information and what we need to pay attention to in day-to-day living.
Oh, great. So I think that we have some questions related to chronic kidney disease or general kidney disease. Could you actually tell us what are the causes for those common kidney diseases?
Yeah, so kidney disease, if we wanted to look into types of them, I like to divide them into the acute ones and the chronic ones. So most of the acute kidney disease, most of them are reversible, meaning that if we intervene and seek medical care promptly, these conditions can be reversed back to normal or near normal. So a large cause for acute kidney injury are decreased blood supply to the kidneys. Of course, the nutrition need, the blood flows to the kidneys, if decrease in various reasons, kidney function is going to decrease acutely. There are a type of autoimmune disease. We usually hear people talking about systemic lupus or IgA nephropathy, which happens very commonly in nation. These are also autoimmune diseases that can cause acute kidney injury. Also some toxins to the kidneys, medications, chemo medications, IV contrast. People sometimes will need to have it when they have a CT scan or MRI. Muscle damages, car accidents, or rhabdomyopathy. People have those kind of byproduct, a large amount too much for the kidney to work on will cause kidney damages. And also if the pipe got obstructed, got blocked, for example, kidney stones, bladder stones, in men in very enlarged prostate, or a local compression by a tumor from the pipe, outside of the pipe, these can cause acute kidney injuries as well. In terms of the chronic causes, we oftentimes heard a term about CKD, chronic kidney disease. So if the acute conditions didn't get reversed or recurrent very often, or the condition didn't get treated appropriately, so it will linger into the chronic conditions and cause some irreversible damages to the kidneys. Of course, and there is a large group of concern that we have are uncontrolled systemic chronic conditions, meaning, hypertension and diabetes, high blood pressure. So these 2 conditions actually, in fact, are the most common cause for chronic kidney disease and kidney failure. And also long-term use of NSAID medications, a large group of pain medications, can cause chronic kidney injuries. Toxins, again, to the kidneys, chemo drugs, and some of the psychological drugs, antiviral medications, and herbal medicines, some of the homeopathic medications, or a person that we call a vascular path, meaning that they have multiple large and small artery blockage, renal artery stenosis, so blockage of the blood vessels that feeding the organs can cause the chronic kidney injuries, and some congenital causes. Polycystic kidney disease is a large one. It's because of the genetic defects in a person.
Could you actually share with us how the blood lab tests indicate any common kidney functions?
Of course. So if you ever get a chance to look at your own blood test results, sometimes in the metabolic panel, doctors will oftentimes order BUN, which is a blood urea nitrogen, creatinine, and also you will see another index is called eGFR, so estimated glomerular filtration rate. So that's what we usually look at for determining a person's kidney functions or whether a person have chronic kidney disease. The current definition for CKD is when the GFR is less than 60, which means that the kidney is working at below 60% of its full capacity for more than 3 months, then we say this person are in the chronic kidney disease definition. So if the GFR is between 30 to 60, we say that it's a stage 3. If the GFR is between 15 to 30, which means their kidney functions are working at 15 to 30% of the full capacity, that's a stage 4. So that's already a moderate to severe stage. And when the GFR fell behind or below 15, we say this person have stage 5 chronic kidney disease, which is severe, and sometimes we refer it to kidney failure. These group of patients usually would pretty soon need dialysis or kidney replacement therapy.
I see. So could you actually share with us what are the risk factors for chronic kidney disease?
So for chronic kidney disease, commonly seen risk factors, number one would be age. The older that we have, our kidneys just naturally deteriorate in their function, which is a natural process. So everybody has it and there's no way you can avoid it. But other reversible and controllable risk factors, it will include a big one is diabetes, cardiovascular disease, which meaning, stenosis or narrowing of the arteries. These group of people usually have strokes or heart attack or heart conditions. Obesity, so having too high a BMI, or someone that with autoimmune disease, as I said, rheumatoid arthritis or systemic lupus. Lifestyle habits, smoking and alcohol consumption are definitely associated with increased risk of chronic kidney disease. Recurrent or persisting urinary tract obstructions, as I said, stones or enlarged prostate can cause that. And of course, medications. So a lot of over-the-counter medications, especially over-the-counter pain medications, some medications that for treating cancer, so chemotherapy medications, some certain antiviral medications, and a large group will be the herbal medicines.
I see. Yeah, those are need to watch out for. Could you actually share with us any complications of chronic kidney disease?
So commonly seen complications of chronic kidney disease, we first wanted to understand what chronic kidney disease means. So basically it's a very impaired or insufficient kidney function. Kidney usually manage our body, the metabolism, trying to get rid of the extra waste, get rid of the toxins, and trying to regulate how much fluid we're going to have in our body, how much sodium and how much other salts, potassium, phosphorus, this kind of salt. So when this function is impaired, it's a syndrome of multiple clinical symptoms that involving a lot of different system or different organ. So when we see a person that have a severe chronic kidney disease, sometimes they have a very special smell. You get into the room, you already feel that the person smells, we call it smells like chronic kidney failure. They have a very bitter and metallic smell of their breathing. So it's uremia that's caused by the special the smell of the urea over accumulating in the body. The water will not be able to get out of the system, so that a lot of people have edema, so they're swollen in a lot of places, not just at the ankles, it will be all over. People will have too much potassium, which cause hyperkalemia and can cause very dangerous irregular heart rhythms. So this is acute conditions that need to be treated. And people can end up with metabolic acidosis because our kidneys are trying to regulate the body's acidity to get rid of the extra acid, and sometimes we'll get rid of the extra alkaline. So when that function is impaired, we will have the derangement in that sense. And then also people, when they have chronic kidney failure, they will also have very hard to control hypertension. So it's worse than their baseline. And the chronic kidney disease can also cause bone disease, osteodystrophy. The bones are being lysed or dissolved because of the rearrangement of the acid and base. People would also have anemia because kidney is an important organ in our body to generate a hormone to tell our bone marrow to make blood cells. Also, we'll see a worsening condition in their cholesterol and triglyceride panels, so causing hyperlipidemia. They will have malnutrition status because oftentimes the kidney were not able to hold on to the protein that's useful and helpful to our body. So our body will have a low protein state and causing malnutrition. Because of the over accumulating acid and other toxins, our platelet, which is a very major blood cells to help our body to stop bleeding, the function is impaired. So they will have increased bleeding risk. Oftentimes you will hear people with chronic kidney conditions, they have stomach bleeding or duodenal bleeding from the GI tract. That's because of this. People might have pericarditis, and they might have peripheral neuropathy causing fingertips and toes numbness or tingling.
Oh, wow, I see. So you mentioned about diabetes and hypertension before. Could you actually share with us how it's actually affecting our kidney? What are the damage it could be done?
Yeah, so when I talk about this, I like to share with my audience the kidney anatomy. So over here, it's a photo of the kidneys and a enlarged details of a part of the kidneys. So on this area, you will see a tuft of vessels, or we call it the vessel ball, or we call it glomerula. So it's a cluster of the blood vessels, mainly the arteries. So when a person have long-term uncontrolled diabetes and hypertension, these arteries, the pipe and the inner liner of the blood vessels got damaged. So when the blood flowing through this filtering network will not be efficient to get rid of the toxins, because of the impaired function of the filter. So in that sense, the toxins will not be able to get out of the system effectively, and also the filter would not be able to retain the material that's useful for our body. And there were also other mechanisms to cause damages to the kidneys, including long-term blood sugar uncontrol, having the glucose attached to the inner liner of the blood vessels and to the tubes here, and cause oxidations as well.
Oh, wow, I see. So is this the main reason, like the most common cause of chronic kidney disease in the United States and the world?
Yes, so actually in the United States and worldwide, the most common cause of chronic kidney disease are poorly controlled diabetes and hypertension, and usually are poorly controlled for quite some time.
I see. So I think many people might ask, like, what are the percentage of diabetic patients might run into chronic kidney disease? Do you
So
have any
that
number?
percentage is actually very, very high. 1 out of 4 or 1 out of 3 diabetic patients will have chronic kidney disease, meaning their GFR or their kidney functions are running below 60% of their full capacity.
Oh, wow, indeed, it's really high. So we need to watch out
Mm-hmm.
to managing the diabetes and hypertension.
Yeah.
So now I think a lot of our viewers would like to learn more about how certain drugs may damage the kidney. Could you actually explain to us?
Yeah, so that also would like to refer to the anatomy of the kidneys. So a large group of medication that we often see could damage the kidneys in our clinical practice will be, some people that use over-the-counter NSAID medications to control pain or control inflammation. So these group of medications, they actually make the blood vessels going into the filter be very constricted. So the blood flow going into the filtration system are very decreased to a point that it will not be able to carry out the normal function of the kidney. And if the kidneys are under long-term influence of this kind of medications, impairment or damages to the kidney functions happen because of that, because you long-term, chronically suppressing those blood vessels, and they will not be able to dilate appropriately, even though after you stop those medications. So when it goes into stage 3 or late stage 4, chronic kidney disease, even though the person no longer taking the NSAIDs, usually the kidney functions will not be reversed back to the baseline anymore.
I see.
Another group of medication will be the herbs, the herbal medicines. Some of them have a lot of heavy metals, and also some of them actually would have direct kidney toxic effects, meaning that damage the filtration system of our natural kidney function. Homeopathic medications, I would like the audience to watch out for, because some of them will actually add some medication, the Western medicines. They will add ibuprofens or small amount of aspirins in there, and people think that is natural or plant-based sort of natural labeling, thinking it's harmless, but in fact it could potentially cause some damages as well.
I see. So you mentioned about some pain medication earlier. Is there any recommendation for pain medication in general to protect the kidney, or a certain medication that we definitely should avoid or limit?
Yes. So a general rule of thumb will be all the over-the-counter pain medications other than Tylenol, or Tylenol's generic name is acetaminophen. So except Tylenol, acetaminophen, all the other over-the-counter pain medications would have a potential to damage the kidneys, including high-dose aspirin. So baby dose aspirin, 81 milligrams is okay, because that's used to protect, having a heart attack or having stroke, having blockage of the blood vessels. So the 81 milligrams are considered to be safe. But if you are taking, 325 milligram aspirin every single day, for just pain control reasons, then I would suggest such person stop doing that and consult with their physician. So I would recommend against long-term use of those nonsteroidal anti-inflammatory medications. So if you are a person that using ibuprofen or Advil every single day, or take it very frequently with high doses to control headache or joint pain or other chronic inflammations, I would suggest you to consult a doctor to find out whether there be other better solutions or other better regimen for the condition.
I see. That's great. So now, a little lighter topic. Could you actually share with us any lifestyle changes that may actually able to protect our kidney?
Of course. So, lifestyle changes, I would like, oftentimes tell my patients, if you're a smoker, stop the smoking. If you are a heavy drinker, cut down the alcohol or stop the alcohol, because these two substances are known to cause or, increase the risk of kidney conditions, kidney disease. Try to control the chronic conditions well, meaning the high blood pressure, high cholesterol, high lipid, and the diabetes, very importantly. So control these chronic conditions well. Maintain a very good, healthy lifestyle. So if you're overweight, we're trying to recommend to drop the weight down to a reasonable range. If it's not exercising regularly, we recommend the person to exercise regularly, at least half an hour a day, 5 days a week. So 2.5 hours of exercise per week would help tremendously decrease the chance of high blood pressure, diabetes, and also a general better kidney health. Another thing is, if you are taking a lot of medications, that nonsteroidals will encourage not to take it for the long term, and always talk with the doctors if you are taking some over-the-counter or supplements. And then obviously, keep an eye on our kidneys and protect them. So having a regular checkup with your primary doctor is very important, because some of the disease can be detected in those annual regular visits, even though you don't have any symptoms.
Oh, wow, that's great. Yeah, thank you so much, Dr. Rao, for your explanation and expertise. So thank you so much for coming to explain to our viewer. And if you like this video, please subscribe, share this video, and even comment this video. And we hope to see you next time. Thank you so much, Dr. Rao.
Thank you, Esther.